Welcome to the Remarkable Dentist Podcast with me, Fred Joyal, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to the Remarkable Dentist Podcast. I'm Fred Joyal, and I'm here with Dr. Jerry Bittner, whose practice is in San Jose. It's quite a story. He's a multi-generational dentist and has quite an expansive multi-specialty practice, has done thousands and thousands of veneers and just really runs a terrific, very successful practice. I've known Jerry quite a while, and he's one of the longtime Fortune friends and family clients as well, and just somebody I admire for his demeanor, is calmness, I would say, as much as anything. Maybe I haven't seen him angry yet. Maybe we can make him angry in the podcast. We'll take a shot at it. But Jerry, welcome to the podcast.
Hey, great to be here, Fred. Great to be here.
So you've been practicing since at least 35 years, right?
Yeah, since 1985.
Yep. So you're cruising into your 36th year. And have you always been in San Jose?
Yes. I was, well, I guess I should start from the beginning, right?
Yeah.
I was born in Hollywood, California. My mother emigrated here from Mexico with her 6 sisters when she was 6. My father's mother came here from Germany and moved to Minnesota, and then he came to LA, and that's where they met, and they got married at 16 and 18. So wow. I grew up a little differently than most people. So, yeah. You know, we were a working class family and lived all over the place. I think we moved every couple of years, but what it did was it instilled a desire to succeed and a desire to do things and change things and help people. And I think, you know, watching my parents go from working in grocery stores and selling Kirby vacuums and working as butchers and produce clerks, car racing, all that good stuff, both parents working. And then my dad had always said he wanted to be a dentist. And I think my mom finally got tired of waiting. So she moved up north, went to Foothill, became a hygienist. And then he finally got on the stick and went to dental school. And I was about 10 at the time. So I was roaming the halls of UOP at 10 years old. So that was my first exposure to dentistry. So kind of interesting because my mom was putting dad through dental school in the 70s. And then she decided, well, if he can do it, I'll do it. So she was the first woman in her class and graduated valedictorian, had my little sister while she was there and doing hygiene, putting them through dental school. So she'd do hygiene on the weekends and go to dental school during the week. So I think that's what gave me my work ethic and my desire to succeed and probably not work as hard as they did. But,
yeah, how can I not do that?
Exactly. So I actually started dental assisting when I was about 12. So, and pouring up models and emptying trash cans. And it's funny because now in the practice, I've got patients that I'm introducing my children that just graduated from dental school to, and they say, yeah, I remember your dad was running around here with shorts and emptying trash cans. So it's coming full circle. Kind of neat.
That's really amazing that your parents, well, your mom, even more than your dad, that she decided, you know, one, to become the hygienist, like tired of your dad waiting to make it happen, and then eventually becomes a dentist herself as an immigrant from Mexico, right?
Right.
And just that's what a great American story, really. And so they both ran the practice. So was it assumed that you were going to go into dentistry? Did you have any second thoughts?
You know, it actually was kind of funny. Right about the time my dad got into dental school, I got, and my mom was doing the hygiene, I got introduced to an orthodontist because when I was younger, we were in a car accident. So I lost a lot of primary teeth. So I had teeth coming out my forehead. So what turned me on was I wanted to be an orthodontist, or back then when I was, 11, 12 years old, orthodontist. But anyway, and that's what excited me. And then, then my dad got into dental school and I got to see all the different things and learn how to do lab work and make gold rings with the casting machine. And then I realized that, wow, why would I limit myself to just ortho, right? So when I went on to dental school and came to my parents' practice, I actually worked for them and two other doctors when I first started out, and they gave me the opportunity to build a practice within their practice, and that's what we did. We were probably one of the earlier group practice in the fact that we had three separate practices in one building. Now, the benefit was we're family. So patients were wonderful. If somebody was on vacation or somebody wasn't there, it wasn't like they felt like they're being traded off on somebody. It was a family member seeing them. I think that's a big plus. It worked well for us. So
yeah, that's huge. Yeah, because that is the hard thing when you've got a successful practice and the patients and you've built this relationship. They don't want to be shuffled off to somebody else. And so you don't get any time off, or you don't, you have to build a practice with associates that build their own patient base. But you had that total flexibility, which is, that's a huge advantage. So when did you get drawn into cosmetics?
Oh, that's a funny story. So when I first graduated in '85, I started building my practice, doing a lot of migrant workers and just blue collar workers, doing a lot of fillings, and a few crowns here and there, and a lot of extractions. And then this ad came about the 21st century dental practice, and it was the Bill Dickerson and Larry Rosenthal show back then.
Okay, yeah.
These were the heretics smoking enamel and doing damage to teeth and doing these veneers. And I went to the course, and then I went to a couple more, and I fell in love with it. And then I was fortunate enough that they thought I was good enough that I started teaching with Larry, and it just kind of went from there. And it got to the point where we were doing, I think I was doing 250 to 300 veneers a month. And so my wife said, hey, you need to be like these big guys that have their own ceramists, because you're constantly complaining about labs not getting you what you want, or it's late, and it got at the point back then, we were getting patients from all over the country because I was also lecturing as well. So it was very challenging. If you had somebody come in from, let's say, New York to see you, you would promise them their teeth, they fly in, the lab promised it was going to be FedEx to you, the day before. Lo and behold, it's not there. Your patient's there, and you still don't have the case, and now you're hemming and hawing. So that happened to me two times.
There's nothing really to say, right? Because
what are you going to say?
Have the veneer.
Yeah, exactly. So it happened to me twice, and I said, this has got to stop. So luckily, my wife, Paula, is involved with the practice. She does her HR and some other things. And she said, look, we got to find somebody that's really great. And we were very fortunate at the time. We were very involved with the ACD that we were able to borrow a ceramist from Dennis Wells. And we basically wined her and dined her in the Silicon Valley, took her to Napa. And she was a single, very young, attractive lady at the time, and just a world-class ceramist. And wined her and dined her. We helicoptered to the wineries. We did everything we could possibly think of to get her to move from Nashville. And that was 19 years ago. And I'll tell you, it was the best move we ever made. The ability to do exemplary work when you have the ceramist right there in the office, when you're prepping the teeth, when you got them in temps, when you're talking to the patient, and you don't have to send a bunch of pictures and explain in words, but they're there as part of the treatment, is huge. And I think it propelled our practice in a direction that we could have never done without it.
Yeah, they gave you the advantage of actually bringing her right into the diagnostic phase, face to face with the patient. Design choices, color choices, all of those things. I say color because I'm not a dentist. I actually don't use the right words.
You're absolutely correct. She would, while I got the patient in the treatment room, she would come in, and then she would, make little comments here and there too. And because of that, a lot of times the patient would actually want to do more, so let's say we started out with 10 units. By the time she got done talking and everything, next thing we know, we're doing the full mouth, or we're doing 14 units. So it was, well, because they heard it from a person that wasn't a dentist too. And they heard it
Yes.
from an artist. And they heard it from the artist's perspective. Yes, I can do this for you. But my favorite term when I see people, hey, you have a pretty smile. Would you like it to be drop dead gorgeous? And there's a fine line between pretty and drop dead gorgeous. And I think for me, it's worked really well in my practice because that's what we've produced and that's what we're known for. So, and it's not something that just I can do. I mean, anybody can do this if they get the right team together.
Yeah, and you're producing enough where you justify having it, and that's what makes all the difference. And what you find is she's paying for herself by increasing the cases.
Oh, absolutely, absolutely.
So yeah, it's so interesting. Whereas many doctors would go like, I love my lab, and that's and they get attached to the idea of the time frame, right? Is that 2 weeks or whatever, and maybe back and forth on a couple of things that didn't fit. That's okay with them. They're used to it. Patients don't like that. That's not a selling point of getting veneers. And so were your parents good at the business of dentistry?
You know what, they did very well with that. They had a regular family, filling, crown. We did everything. We did fillings, crowns, endo. My mom used to be very good at oral surgery. My dad could do endos just as good as an endodontist. He wanted to be an endodontist, but my mom told him, look, you've had enough school, get to work, damn it. So, so basically when there was endo in the practice, it went to him. When there was surgery in the practice, it went to her. I got the fillings, so it was, and I got the crown. And then later, as they retired, I got more. But it was really neat because we had the best of both worlds. I had my own practice, yet in a sense, I was in a group because if I wanted endo done, which I could do, but he was so much better at it, I could just tell my patient, hey, you know what? I'm going to have my dad do this for you because he does this great. He loves doing this. And the patient's now not leaving my office.
Yeah.
You know what I'm saying? And it just made things really, really convenient.
Yeah. So you were decades ahead technically on the multi-specialty approach.
Without realizing it. Yes.
Yeah. Yeah. I mean, because that's what, we're recommending now, what Fortune talks about as the ultimate, solution. If you're not going to participate in a DSO, you need to have a multi-specialty practice. You were already exercising that patient convenience aspect, better diagnostic aspect, and speed to completion. Or, I'm talking to a friend of mine right now, a dentist that I coach, and he had to send, he's a periodontist. He did an implant, had to send the case back to the GP that was the patient's dentist to do the restoration, and the guy messed it up. And the guy is he is looking at it when the patient comes back to him, and he says, "Oh my gosh!" And it's like he couldn't hide his shock at what had happened, in terms of the restoration. And the patient went, "What's wrong?" And he went, "No, what? I need to talk to your dentist. So go back to him, and I'm going to call him." And the GP was fine with it. There's nothing wrong with it. And he goes, like, I'm seeing a line of decay above the, like, what's going on? So, you eliminate that worst case scenario right there with basically somebody else has to complete the restoration part of the specialist case, and they don't care. There's nothing in it for them almost in their minds. So.
And I think to be fair, Fred, it's difficult because that's one of the reasons why I have a surgeon in the office, because I've worked with some excellent oral surgeons, but you're sending your patient to them. So what are they going to do? They're going to put that implant where the best bone is. They don't know where the hell to restore it. So I was getting implants placed in beautiful bone that were solid as rock at Gibraltar, and it was physically impossible to restore them. So about 9 years ago, I got a maxillofacial surgeon in the office, and I started doing my own implants. But then I happened to luck into finding this gentleman, and He's a phenomenal surgeon. And what's great is when he goes to put an implant in, he calls me in the room, Jerry, where do you want it? And I'll say, I need it right here at this angle, right here. And he goes, well, I'm going to really have to work for that. I go, that's where I need it. And that's where I get it. Big difference from when I sent it off and it'd come back and it's at a 45-degree angle and it's an anterior tooth and it's sticking out the lip. Now, how am I supposed to restore that? But it's solid. It's solid. You can hang them off it, right?
Yeah, it's in there. It's just going to be right out front all the time.
Right. Yeah. We're going to make you look like a beaver, but that's okay.
That's our trademark. Yeah.
Exactly.
So,
beaver.
So there's accountability both ways. And the patient benefits, obviously, and it's a coordinated effort. I mean, I really see that everybody benefits from the approach. And it's certainly, it's a more profitable practice from that standpoint, because they're now, we can get into your business structure a little bit, because I think people are going to be curious about it, because now you also have a couple of GPs working for you at this point.
Correct.
Yeah. And there's a new kid in the office, a family member who has gone the ortho path, right? That daddy decided not to go, right?
Well, actually, that's my sister, my little sister. But I have twins, boy and a girl, that just graduated.
I was going to say, how did she get in there so fast, right? Your kids just graduated.
No,
right?
yeah, no. My sister's been an orthodontist now for 12 years. So she helps design the Invisalign cases, or if there's something that needs edgewise, she'll come in and do that. But so we've got her on call all the time, which is nice, which is very nice.
And so when did you start getting involved in getting coached by Fortune?
You know, I think I've known Bernie for a lot more years than I care to admit, but I think because my dad retired about 18, 19 years ago. And I think Bernie and I were both in the same lecture series or whatever, where we were always seeing each other in different venues when we were lecturing. And I think I came to Bernie and said, hey, my dad wants to sell his practice. I really don't want to buy it. But since I'm in the same building, same facility, what I don't want, he's got two big DSOs looking at it right now. And what I don't want is a Western Dental practicing with me. And so I said to Bernie, I go, what do you think I should do? Because at that time, I was strictly just doing cosmetics, nothing else. I even stopped doing hygiene, which was really stupid in retrospect. But anyway.
We're going to dig into that a little bit.
Yeah.
That's interesting.
But to make a long story short, and I've got to thank Bernie for this, because my father, again, this was a man, the self-made man, and he didn't become a dentist till he's 35. So you think about it, and he built this phenomenal practice that, a couple big companies wanted to buy. And so, he felt it was worth one price, and it was really worth about half of what he wanted. But, Bernie just looked at me and said, Jerry, do you want to practice the way you want to practice? And do you want to be in a relationship, or do you want to be right? And I looked at him, he says, just pay the money. Trust me. It'll be fine. Well, we're producing 6 times what I bought that practice for. So, every year for the last 19 years. So, it was fine. He was right.
It's fascinating. Yeah, we're talking about Bernie Stoltz, who's the CEO of Fortune Management. And then every event that I go to that's involving Fortune and Fortune members at every tier, you're there. So you're
a client now for 20 plus years. Yeah.
And so let's go back, because this was the Dickerson, Larry Rosenthal era when you first got started, and they were really preaching abandon your normal drill and fill sort of practice, right? So they were go full cosmetics, right? That was the recommendation.
Absolutely. I think Bill Blatchford at the same time used the analogy, you go to the island to fight, burn the boat so you can't get off, right? So that was it. Get rid of your front desk, get rid of your hygiene, just smoke enamel. you know?
Yeah.
So I think that, I went that way and did it very successfully for 8 or 9 years.
Yeah. And a lot of guys didn't. A lot of guys, they couldn't build the veneer business, the cosmetic business fast enough. And so they sort of fell off a cliff because they didn't have the bread and butter dentistry to support them. But you actually powered through it. Now, of course, you've expanded into everything, back into everything. But you mentioned you got rid of hygiene, which was probably not advisable. You wouldn't recommend
probably
it.
The most asinine thing I ever did. Yeah. Was not smart.
Because hygiene's a driver, right? Hygiene is
Correct.
The cosmetic case has got to come from somewhere. You can't just hang around outside handing out business cards everywhere you go and telling people they need better teeth. So the hygiene really works. So when did you fix that? So
It's been about early 2000, decided to start building the hygiene program back and everything. And that's when, I got associates in again to start doing that. So, sometimes you're better off being lucky than smart, I think, Fred.
Yeah. Oh yeah.
I was fortunate because the same time I jumped into the aesthetics, I jumped into the laser arena with the hard tissues. So I was one of the first of 3 doctors in the nation to have a hard tissue laser. So consequently, what ended up happening, and now I'm really dating myself because I know everybody knows Dr. Oz, but do you remember that guy, Dr. Dean Adele?
Sure.
Okay. So he was in my office at least half a dozen times filming me using the laser. So I was on national TV with this. So consequently, I was getting so many new patients from being on national TV that's why I was able to sustain that veneers without hygiene, because I was on TV all the time. So just luck.
And you were prepping veneers with the laser.
I was doing some of the stuff, crown length and whatnot, with laser, tissue recontouring and whatnot. But again, I was the cosmetic dentist that was using laser. Nobody's using lasers.
Right, that they didn't know what it was for. The patient didn't know what it was for.
Flying from all over the country. Right. Yeah. So it was a lucky thing.
Yeah. And so I imagine your laser use has evolved as well as the lasers have evolved. So everybody's going to say, so what's he use now? What's the laser he likes now?
Actually, Fred, if people go in my office, they kind of look at me like, this guy's one crazy dude. I've got 4 hard tissue lasers. So Waterlays, Laris, AMD, Solea, and they're all wonderful. I think for somebody, if they didn't have all the investment already, they should probably start out with the Solea now. I think that's your best all around laser now, but again, keep in mind, I've been doing this since the 90s. So things have evolved. I mean, my first laser, I think it's a boat anchor now, but this thing weighed, I don't know how much. And it just cut soft tissue. That was it. Nothing else. And if you weren't careful, you fried everything. Right. So then DEAG, right. So yeah, I'd say the Solea would be the best bet for most people right now.
And you're fully teched up. I mean, obviously, if you were into lasers, you incorporated CEREC and cone beam and anything that you were the manufacturer's dream, basically. Here comes Jerry, and he's walking out with a new device.
Oh,
right.
Great! Get out the latest gizmos. I mean, we started out way back in the 80s, with aerabrasion. The old.
Oh wow!
Old aerabrasion. And then for curing argon lasers, because, I did the math way back then. It was weird using Dematron lights to cure, 6 layers, a minute a layer. That's 6 minutes of curing. And you could buy a $15,000 argon laser at the time that would cure a layer in 3 seconds. So I did the math and I go, shoot, I'm saving 80 hours a month curing. This thing can pay for itself, right? And I think too often, doctors don't think about that. They don't think about what's their time worth, or more importantly, how much do you have in your hands? How long are these going to last?
Right.
And now I'm going to get on a soapbox, I guess, if it's okay. I mean,
sure.
guys that are discounting themselves, they're not just hurting themselves, they're hurting other dentists, but more importantly, they're going to go handicap quicker doing twice as much work for half the price. Because again, we're not machines. This is only so good, you know?
It's a physically demanding job, and to do it well a long time, you have to constantly be thinking about, you know, your ergonomics and how, you know, what strain you are putting on the machine, and then let's add, you know, 6 to 8 minutes of curing as a patient is no vacation time either for them. So when you compress that time, they didn't know maybe it was going to be longer. They just knew it was pretty fast, right? So you know, that's using technology. You just went in and said, like, I'm going to figure out how to get the most out of this technology, and then start to run the numbers on it. And it is very much a, you know, so much of dentistry is a minute by minute game. Like how because again, as you say, multiply it times 200 every time you can figure out a way to save a minute, right? So you know, workflow matters. You know, efficiency chair side matters. How much is delegated to extended function people? Now, at what point did you really start incorporating extended function RDAs?
You know, we've been using them a lot, pretty much all along. I mean, my girls do an awful lot, and there's certain things that they could do, but the way we don't overlap patients because of the way we practice. So we try to practice more high touch, and we want people to feel like they're in a spa. So I don't have a waiting area. I have a welcoming area, right? I mean, I don't have an area that people actually sit and wait. If you walk in my office right now, I have a huge entry, but it's not a waiting area. It's a welcome, and they're out of that front area within 2 minutes or a minute or less. Yeah. So let's say, you know, now that, you know, we're using the CEREC a ton more, that's the only time we got people waiting, but they're waiting, drinking coffee, or they go out and have a snack and come back, but they're not really waiting for procedures to be done. You know what I'm saying?
Yeah. Yeah. So you're attending to a patient. Expand on this a little bit more, because I think conceptually, I'm not sure every doctor can get that on the first pass. Is how you think it.
Oh, when I graduated in '85, the big deal was Jim Pride had the wheel. It was called the wheel, and basically you were supposed to have 4 ops, and basically you put a patient in each op, and you ran around like you were on a big circus wheel, right? Where you give anesthetic to one, and then you leave them there to sit for 10, 15 minutes, get to the next one that you gave anesthetic to, and you do the prep. You get to the next one that you did the prep, and the assistant's starting to feel it already. You go in and you check it, and you do the occlusion, and you go to the next one, you pat them on the rear band saying, "Hey, great, Mrs. Snaggletooth, I love you. We'll see you. Make an appointment for, you know, your hygiene appointment." And then you go back and continue all the way around. And so you book all these patients 15 minutes apart. The challenge is one of them actually gets you a little behind. Now you got a full waiting room, right?
Yeah.
So, you know, and I think part of that is we weren't doing quadrant dentistry back then. We were doing onesie twosie things, right? So you had to do that. You know, now we do the minimum I'll do is quadrant. Most of the time I'm doing half arch or full, you know, both, everything, full mouth, all at once. So again, the appointments are a little longer, so there's less patients running through, so it doesn't look so busy. Now you still have your hygiene, and you still got to get up and give them a rest break so you can go do a hygiene exam. But that's where having extra people there or extra doctor there help too, because then you don't have to do that as much. So let's say the way I've got it set up is, let's say a hygienist needs an examination, and that doctor is with the patient, and that's an important time for them not to get up right now. Well, we all wear headsets. So they just radio and say, "Hey, you know, can you say hi for me and have Dr. So-and-so do it?" So it makes things go a lot smoother. The patient, you know, is happy because it's, you know, they're right in the middle of procedure. She said to say hi, and they wanted me to know that they told me this, and the other thing, right? Now the patient feels good about another doctor coming in, and now 2 things have happened. That patient has to have weight. They've been taken care of nicely, and now they've met the other doctor. So if something happens, to where that doctor's not available, well, they've already met that other one, so now they're okay to see them. Does that make sense?
Yep. Yeah. Because it's so important not to get them fixated on one doctor.
Absolutely. And that was the hard with hygiene, right?
Yeah.
I mean, most of us have hygienists your patient loves. Oh, if Mary's not here, I'm not coming in. Well, it took us a long time to fix that. And it's the same thing, if we always set that patient up with the hygienist they want, but if they move that appointment and then they're going to see another hygienist because we want them to stay on the correct interval for their health. It's all about them, right?
Yeah.
And then what happens is we'll come in and say, hey, you know what? I know you like to see Mary, but in order to keep your healthy interval, we're going to have Sue see you. But when we're all done, we're going to reschedule with Mary for you next time.
Yep. Yeah. So that they're adapting, as you say.
Exactly.
You're not creating an addiction to one person. You're saying just get across. Everybody's good, and they also figure it out. They go, wow, she's just as good as Mary was. So I don't care. Or she's even better. She's my new favorite, whatever,
Mm-hmm.
But it keeps you from being trapped when I know I can't count the number of dentists I've talked to who are held hostage by their hygienist, right? They go, I can't lose her. She's going to take half the practice with her. It's like,
right.
Well, what's wrong with that formula, right? First of all, what's wrong with that belief? But you've really put yourself in a tight spot where maybe she could, take a quarter of the patients if she decides
right.
to leave. Now she's calling the tune. She's wagging the dog at that point. So doctors beware of, this is why you want, first of all, a lot of them have one hygienist for themselves instead of two. They don't even have the right ratio going on for themselves. Or worse, they're doing some of the prophies themselves, which is really moving backwards, I think, so.
I think there's only one time where the dentist should be doing the prophies, and that's when you're a new dentist coming into an office. And I've done this over the years with new associates that have come in. I make them do hygiene for the first month or two, because
Sure.
That's a great way for them to meet the patients, build relationships, and now the patients will trust them to do the work. But if I bring in my patient, I have a new associate. Okay, now I'm going to have my new associate do your work now. They look at me like, no, right? So for me, I found that, and that's exactly what I'm going to do with my son and daughter that are coming in now. They're going to do hygiene for probably the next month or two, or maybe 4 or 5 until the next cycle, right? And then meanwhile, the hygiene they're doing, they've already pulled work and diagnosed work out of that, and the patient's happy to let them do it. Versus if the work were diagnosed and then I said, hey, can they do that? I'd get a hem and a haw.
Yeah. Yep. Absolutely. Makes perfect sense. So this is where I was going to go next is you and Paula, your wife, made the mistake of having twins, right?
It was a surprise.
And of course, put them both through University of the Pacific, right?
Yes, that was
at the
also
same time.
Surprise. Yes.
Yeah, it's too bad one of them didn't want to join the army or something.
Yeah.
But you made it look too good, Jerry. I mean, that was the other thing.
Tickled pink to have them on board, and it's really neat. It's really neat.
Now, UOP is also. Did they do the 6-year thing, combination in UOP, or what?
No, they both went to 4-year undergrad, both neuroscience degrees, and then on to UOP Dagoni. Yes. So they did.
So it took them 8 to get out.
Dagoni's 3 years. 3 years.
Dagoni's 3. Dagoni's 3. Yeah.
So it's 7 instead of 8. Right.
Yeah. So it's only 14 years of college that you've paid for. That couldn't have made a dent in your vast wealth at all.
And my oldest just got her master's in Santa Clara for psychology. So 3 in college at one time in upper education. Yeah, it was a lot of fun years, Fred. Let me tell you. That's why those gray hairs are there now. They never used to have gray hair.
You needed a multi-specialty practice for sure.
Absolutely.
At that point, you were running a multi-college practice.
Exactly.
So but they're out and they're both coming into your practice.
Well, they've actually been working for 2 weeks now.
Oh,
Yeah,
wow.
it's awesome.
That's great.
Yeah.
Yeah. I've met your son, and he's going to be great. He's got a terrific demeanor already. So I think he's picked up the whole family chairside style that is proven so effective. But what a great thing. Now this is the third generation coming in pairs, basically, because your parents were there. Now you with your sister coming in sometimes, and now your two kids coming in. Now, are your parents still alive?
Yeah. They're both alive and doing well. My mom still plays in the USTA tennis circuit. She's in the super seniors, but since she's 82, she's having to play 70-year-olds because there's not a lot of 80-year-old tennis players left.
Yeah, that's they tend to drop off when
They do.
The earth or the game, one or the other. Yeah. So, well, that's got to be great for your parents to see the success that you created, and also that now their grandkids coming in like this and into something they started. I mean, your mom kicked off something really phenomenal. Talk a family dental tree there. It's really.
Not only they kicked that off, but then, my mom was also on the board at the dental school. So she started the Kids in the Clinic Foundation, 25 years ago. And her goal back with Art was to raise $1 million endowment to treat kids with special needs and AIDS and everything. And, have it constantly going. Well, that foundation's already grown to 2.5 million. And we've treated, 80,000, 90,000 kids for free, orthodontic surgery, cleft palates, fillings, crowns, whatever. And so it's been pretty cool. So our family's been a big part of that for a lot of years. So, it's amazing, the ripple effect people have.
Yeah. Yeah. I mean, her legacy and your parents' legacy is phenomenal. Just we're talking about, tens of thousands of people impacted, maybe even into the hundreds of thousands who, at this point, with this many years. And your kids are coming into such an amazing new age of dentistry with their baseline technology is something you couldn't even have dreamed of in school, So how exciting for them, and to come into a thriving practice that with the technology right there at their fingertips, but also your experience. You've trained a lot of associates at this point through your practice. So they're coming, you have the experience. You're not just bringing your kids in going, I wonder how I'm going to handle this. You know how to groom an associate. So they're lucky from that. They may not feel that way when you make them do some of the more menial tasks, but
they're actually very excited. They're having a blast right now.
Yeah.
Fortunately, the two other associates I have are the newest one I got. She's a jewel. She is an absolute jewel. She's been out of dental school 2 years, and she's already rocking it like no tomorrow. And then the other one's been out for 14 years, been with me for 8 now. And so they're both younger. I think Ria's 29 or 30, and Jen just turned 40. So it's like having new young blood. And it's funny because they're all excited to have them there too. So I see just this causing a whole nother kickstart of another super jump in the practice, because all of a sudden we got these young, energetic people. As much as I like to think I'm good, I'm getting old. And, as you get a little older, you get a little more, you're not that warrior anymore. You know what you want to do, but you don't have that drive like you used to have.
Yeah.
So it's so nice to see that. And you know what it does? It excites employees too.
Yeah.
Because you and I both know, Fred, you can tell people everything, but if you're the old complacent guy, they don't hear it as well as if you're young, energetic.
Yeah.
Right. So that's exciting.
Yeah, I mean, I think the team will be energized. I think this is exactly what's going to happen. Is you're going to watch another exponential leap in the practice, and it's going to be great for you and Paula, who your wife who works there, and as marketing director in HR, and I'm sure whatever else comes up. But you guys, you've also had the opportunity to have her there. And so it's this is as family a practice as you can get, pretty much. So good for you. Now, what's next for you? What do you see as how many years do you think you're going to keep at this?
I guess as long as they let me stay.
Yeah.
And that's actually a funny question. I had a lot of patients ask me right now if I want to retire. Fred, I'll be honest with you. I look forward to going to the office every day. Now, what I finally started doing is going home a little early, whereas I used to be the first one in, the last one out. So, what I would like to do is see this practice, grow double, triple in size, before I ride off into the sunset like John Wayne. But it's interesting because I guess what I want to do is I want to be there to facilitate and to enjoy watching their success.
Yeah. Yeah. Why not be able to see it? Yeah.
So. You know what? My parents, I notice how much of a kick they get out of, when they come in the office for a cleaning 3 times a year. They're always amazed at the new things I've got there. Or they're always telling me how proud they am of what I've done. So.
Yeah. No, it's a beautiful thing. And the great thing about dentistry is you can, if you scale it back soon enough in your life, you can come in there at 85 and still do one day a week, or one day every 2 weeks and get to enjoy it and still feel like you get pretty addicted to having this kind of impact on people's lives. To stop doing that is probably pretty hard. You got to be really burned out on the profession and just go, I never want to walk in there again.
Well, and I think, and I've got to thank Bernie Stoltz for this, because he, especially back when I was doing a lot of veneers, he said, Jerry, you got to stop being the man. You got to teach other people. You can't be chained to the chair. And, he's right. He's right. Because I'll be honest with you, if I wasn't in a bad accident many years ago, I probably wouldn't be doing things the way I'm doing. I'd probably still be the man doing all the veneers and having people come and see me. I'm getting more joy out of now seeing my associate or watching my son or my daughter do this and hearing them get the compliments. You see what I'm saying?
Yeah.
And that's neat. And you know what? Okay, once in a while, I'll sit down and I'll do it. But I know now that my goal is to have them better than I was ever. And if I can do that, I've accomplished something.
Yep. No, well, you're well on your way. So, anything you would, tell young dentists coming out, what their path should be, if you were to recommend something?
I look back at, I think the smartest thing that I did is getting with Bernie. And it took me a lot of years, but getting with Bernie. If I had done that right off the bat, if I'd gotten with somebody like Fortune right off the bat, I would probably be way farther ahead. We made a lot of mistakes. And you say how calm I am, my right before Bernie, I got a consultant. I actually got kicked out because he called me Mount Vesuvius. Because I used to just, it'd be like I'd be calm and cool, and then 1 second, and then I'd blow like a volcano because, it wasn't going the way I wanted. So I would say to any young person, get some coaching right away, because I think that really is helpful. And, and find a mentor, somebody that, and this is a great example why when I was with the Bill and Larry show originally, I went off with Larry instead of Bill Dickerson. And Bill Dickerson's an amazing clinician. The challenge is Bill's attitude, he's God and nobody's going to be as good as him. Larry's attitude was, Jerry, you know what? You're already better than me, and I expect you to get a lot better. And that's the way I am with my associates. That's the way I want to be with my kids. I haven't done my job if they're not better than I'll ever be.
Yeah, that's powerful. And it's an amazing, fork in the road, really, that you chose. And I think you were drawn to it. But what a difference that's made in your life, and certainly in the lives of people working for you, and the patients who get to benefit from it, because your practice is significant. It's impacting thousands and thousands of people on an annual basis. It's an amazing thing to be able to get to do in your community. So, Jerry, always a pleasure to see you, but really good to hear the whole story. I'm so fascinated by the story of your parents. I just think that's just a beautiful American story, and a beautiful multi-family, multi-specialty practice tale. So thank you. I look forward to seeing you. I look forward to getting to know your kids as well. Yeah, we're going to see you next week. We're going to be hanging out pretty much the whole week. So thank you.
And I survived, Fred. I was worried that, but I think I did okay.
Yes, you did. You did. So for everyone listening, this is Dr. Jerry Bittner in San Jose. I'm going to give you some, you'll be able to look at his website, stuff which is also, from a marketing standpoint, extremely well done. All of the elements are there that I would recommend are on his website. So the practice is well promoted, but he's promoting himself the most effective way he can by making it a patient-centric, patient benefit practice with the highest standards and the best results. That's what's going to draw patients more than anything. So, Jerry, thank you. I wish you even greater success and more joy, and I look forward to seeing you soon.
Thank you.